Old age creates a lot of health problems when we get older, and we always try to find ways to improve our lives now before we have a hard time enjoying the things we love doing further down the road. Taking care of your body through exercise and having a healthy eating habit can create less health problems if we take care of our bodies in the right way. Your teeth have no exception to maintaining a healthy lifestyle to reduce problems when you are older. Teeth are so essential in our lives by chewing to break down food for digestion and communicating to others clearly.
The teeth that you have are part of your body by containing blood vessels that supply nutrients to your teeth and nerves, which connect to other parts of the body, such as the brain, which aids in sensory perception. Losing a tooth and creating this disconnection to the body can cause impacts to our future health, especially having a connection to the brain through a neural pathway. A disconnection of a neural pathway can lead to changes involved with the brain, and the impacts that these changes have are associated with dementia and Alzheimer's disease being the most common form of dementia.
We often associate dementia or Alzheimer's disease to older people that have seen abnormal brain change to their memory, language, problem-solving, and thinking ability. Lots of causes to abnormal brain changes can happen in a person's lifetime, but losing your teeth and this disconnection to the brain plays a role in the changes of white matter and a silent infraction of the brain. It is important to know that the teeth's main and major role is chewing for the breakdown of food. Teeth can be lost throughout our lifetime by the cause of gum diseases, cavities, smoking, injury, and drugs, which is a small list that is associated with tooth loss. With the loss of teeth, there are biological mechanisms that suggest a higher exposure to pathogenic oral bacteria, also known as Poriformis gingivalis. This bacteria produces endotoxin or gingipains that exacerbate beta amyloid deposition, and it stimulates neuroinflammatory response in the microglia and astrocytes, which leads to dementia-related pathological changes. Older people are usually associated with extreme loss of teeth throughout old age and/or other factors that can cause a reduction of chewing certain foods. In fact, about 1 in 6 adults aged 65 or older have lost all of their teeth, which decreases the amount of times you are chewing.
Studies have shown that chewing helps to maintain cognitive functions with memory-related improvements in the hippocampus and can be a useful approach to improve these functions for older people. Research has also shown that the hippocampus has insulin receptors that may help improve cognitive functions and memory functions due to chewing being one signal to help the body release insulin. Having these cognitive connections can improve the abnormal changes to the brain, but a missing tooth that is lost is still losing that disconnection from the brain that shows white matter and silent infraction to the brain.
A study that proves these changes to the brain with having an association from losing a tooth was tested by patients who were aged 50 through 75 years old to see changes in white matter or a silent infraction, which is a stroke that does not have any outward symptoms being associated with a stroke. After collecting the data, odd ratios were given to measure the exposure of missing teeth to the outcome of either white matter change or silent infractions. As more missing teeth increase in patients, the increase in odd ratio grew larger. This is showing that the increase of tooth loss increases the patient's chance of having white matter changes to the brain and silent infractions that affect the brain. This type of study concluded that tooth loss may be a predictor in white matter changes and silent infractions.
You now know that changes do happen to the brain when losing this disconnection from the body and from a missing tooth. The question now becomes, what is the communication that's happening between the tooth neuron and the brain? And are there important signals that the tooth gives to the brain that causes these abnormal changes? These simple questions come back to the basic of understanding communication between neurons.
Acetylcholine, which is one of the many neurotransmitters, is released from neurons in neuron cell communication. Acetylcholine is associated with heart muscle and other muscle contractions, but has a role in learning and memory. Another study that was conducted with rats was to show the tooth and brain communication with the role of acetylcholine that it made by measuring the concentration of acetylcholine in the cerebral cortex and the hippocampus.
This rat study used a control group of rats that had no molars taken out and an experimental group that had all of their molars extracted to evaluate both learning and memory through certain tests that would compare the two groups of their response latency. From the data that was collected measuring acetylcholine levels and comparing the response latency for the two groups showed that the rats that had all their molars extracted had significantly low acetylcholine levels in their cerebral cortex and hippocampus compared to the control group. It showed that with tooth loss, lower acetylcholine levels in the cerebral cortex and the hippocampus had an association with a decreased learning ability.
With the low levels of acetylcholine happening in the cerebral cortex and hippocampus of the brain due to a tooth being extracted results in abnormal changes to the white brain matter and the occurrence of silent infractions in the brain. These abnormal changes to the brain run a higher risk in learning and memory disorders such as dementia that can lead to other diseases such as Alzheimer's.
Keeping your teeth clean and healthy can cause less tooth loss, so other health outcomes such as dementia and other forms of diseases that happen due to abnormal changes to the brain. Maintaining healthy teeth is just as important to eating healthy foods to help cause less health problems for you in the future.